Welcome to the press briefing today. The two doctors today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Now, Dr. Au, please tell us about the cases. Good afternoon, members of the public and media friends. I will now report to you the cases recorded yesterday by the CHP on the 6th of April. That is yesterday. Yesterday, there were a total of 1,368 cases tested positive on PCR test, including 242 cases confirmed by the Hospital Authority, 247 cases confirmed by our Public Services Laboratory of the CHP. The remaining 879 cases were confirmed by private laboratories. Yesterday, there was a total of 1,276 patients confirmed via RAT. They have submitted their results on our platform. In total, yesterday, we had 2,644 positive cases. So far, in the fifth wave, the accumulative number is 1.1706 million positive cases. Among them, 735,479 cases were tested positive on PCR. The remaining 435,125 cases were tested positive on RAT. Among the cases yesterday, 12 were imported. The remaining 2,362 cases were all local cases. Among the imported cases, 3 were found to be positive at the airport, that is the temporary specimen collection center. They came to Hong Kong on the 6th of April from Singapore, the United Emirates, and Thailand. The remaining 9 cases were tested positive during hotel quarantine. 6 cases were tested positive on PCR on the 6th day. And all of these cases arrived at Hong Kong on the 11th. 5 from Thailand and 1 from South Africa. The remaining 3 cases from hotel quarantine were tested positive on RAT. 1 case is from the UK, arrived at Hong Kong on the 1st of April. 1 arrived from Korea on the 2nd, and 1 from Canada on the 4th. In terms of genome sequencing, we have performed genome sequencing for 508 samples. We have found no samples with L452R strains. 494 samples tested negative on the strain, which means they were Omicron strain. The remaining 14 samples were unconfirmed. From care homes, we have recorded no new infections from care homes which have not reported infections. So far in the fifth wave, there are 787 care homes for elderly people which have experienced outbreak, and 290 for RCHD. Yesterday, 33 care homes which have experienced outbreak reported new cases involving 54 residents, and 9 care homes where cases have emerged which are RCHD reported 13 new infected residents. In terms of the number of deaths, so far in the fifth wave, we have recorded 8,344 deaths, an additional 97 cases compared with yesterday. The mortality rate so far is 0.71%. Among the 8,344 death cases, the ages are from 11 months to 112 years old. The median age is 86. 8 children passed away. 322 deceased patients were adults aged between 18 and 59 years. 8,012 cases were elderly people above the age of 60, accounting for 96% of the total deaths. 5,915 deceased patients were above 80, accounting for 70.9%. Thank you. Now, Dr. Lau, please tell us about the situation in the HA. Good afternoon. So far, 9,769 patients are undergoing are receiving treatments in our public hospitals, the North Lantau Infection Control Center, the CHP's Infection Control Center, and the AWE Community Treatment Center. Last night, we have reported another 12 critical patients, 21 serious patients in serious condition. For critical patients in ICU, there are 75. As at 0 a.m. today, in the last 24 hours, 90 patients tested positive with COVID passed away, including 52 males and 38 females, aged between 27 and 104 years. Among the deceased patients yesterday, 48 patients were from care homes. 44 were not vaccinated. 21 received one dose. That is 71 deceased patients were not fully vaccinated. That is 78%. 17 patients were given 2 doses, and 2 patients received 3 doses. For elderly people above the age of 65, there were 85. So I would like to report to you about the 2 younger disease patients. The first one was a 27-year-old male patient. He has a chronic asthma condition. According to the medical record, between the 16th and 18th of March, he checked into the Eastern Hospital because of asthma. He approached the A&E on the 16th. The RAT came back negative. Same for the first test after admission. On discharge on the 18th, the PCR test came back positive with high CT value around 42. So he went home. He was stable. Yesterday, he suddenly lost consciousness at home, and his family members called an ambulance for him. The ambulance man found no pulse and breath and performed CPR immediately. He was rushed to the A&E. Resuscitation was performed. Sadly, he has lost the vital signs, and he passed away. The other patient was a 52-year-old patient with breast cancer, which has metastasized to other parts of the body. The first RAT test came back positive on the 12th of March. She saw a doctor and was prescribed with some drugs for alleviation of symptoms. Yesterday, she was found to have lost consciousness at home. An ambulance was called. Resuscitation was performed immediately. Upon arrival at the A&E, she was found to be unresponsive and with a heart arrest, and resuscitation failed. And because of data backlog, we have to report some death cases on the dated the 5th of April. 7 patients passed away on the 5th, including 4 males and 3 females aged between 72 and 100 years. On the previous day, another 1,491 patients were discharged, and another 10 patients were found to be positive upon admission screening. Some 20 patients in the same ward were classified as close contacts. For staff, so far 21,364 patients colleagues were infected. 19,608 colleagues have returned to their positions. Thank you.
And now it's time for questions. Please identify the media organization you represent. Please. TVB. The HA mentioned the 27-year-old and the 52-year-old patient. Were they vaccinated? And both of them went back to the hospital afterwards. Did they die of natural cause, or did they die of COVID? And the Secretary for Education, Mr. Kevin Yeung, said that he would discuss with the DH about the possibility of relaxing the resumption of classes, like if a student tests positive, then there will be an arrangement. Is there a likelihood for relaxation regarding the class suspension guidelines? The number of cases has come right down. There are 2,000 cases today, and it's only today that we've seen a drop in the fatalities down to about 90. So why is it that the death rate is coming down so slowly? And also the Lok Ma Chau Loop Emergency Hospital, how many do you anticipate will be sent there, and who will be prioritized for sending to this hospital, and what's the utilization rate like at the moment? Right, let me address the question regarding class suspension, and then I defer to Dr. Lau regarding the Loop Emergency Hospital. Over the past year, the CHP has been discussing with the Education Bureau regarding the resumption of classes on the 19th of April, and how on the campus we can curb the spread of COVID. We're looking at a number of things. If suspension has to take place, what are the criteria, under what circumstances would this happen? And it, of course, depends on the state of the pandemic. We hope that by the time classes resume, the COVID situation would become stable, and the risk of transmission would be relatively low. We hope that prior to going to schools, the students will need to get tested if they have any symptoms, that they should get tested and they should stop going to school. If there are cases identified in schools, they should notify the CHP as soon as possible, and we will conduct investigation and have regard to the school situation and decide on the follow-up action. As regards the details and nitty-gritty of class resumption, we're in discussion with the Education Bureau, and an announcement will be made shortly. As regards the two deceased patients, the 27-year-old patient, on record, he was unvaccinated for COVID. He's also an asthma patient, and he had to be admitted to hospital for asthma to the ICU at one point. We can't be certain about the cause of death. Before being admitted to hospital, he had no heartbeat, no breathing, and normally the forensic pathologist at the mortuary will decide whether autopsy will be conducted to identify the causes. The other one, the 52-year-old patient, my record shows no vaccination for COVID. It seems that she has a history of breast cancer, which has already metastasized. She passed out at home and became unconscious. Before being admitted to the A&E, she had no heartbeat, and she was sent to the public mortuary for investigation to identify the causes of death. As regards the Lok Ma Chau Loop area emergency hospital, there will be 1,000 negative pressure beds, and this will increase our capacity for admitting patients in the unlikely event that there are huge number of patients let's say, come the sixth wave, we will have added capacity for meeting patients. Now, the COVID situation has eased a little bit, and the CHB has repeatedly reminded the members of the public that during these holidays or in recent times, there are a lot of people who have let their guard down, and it is likely to lead to a resurgence of cases. And there is a likelihood that more people will need to be admitted. We hope that these beds will not be coming to use, but where necessary, we can activate these beds so we have the beds available for patients. As to the detailed arrangement, we understand that the government is doing the coordination. The hospital authority will be tying in with the government and work out the arrangement. Speaker not coming through. I think you are talking about the daily fatality numbers. And let's say yesterday we had the new cases. Some of them are delayed announcements. Some of them were deceased over the past couple of days. There is a gap between the time of infection and the time of the of death, maybe a couple of weeks. We would look at the trend of cases and the trend of fatality. Both are coming down, although the fatality rate is coming down with 1 or 2 weeks time lag. That's because there is about 1 or 2 weeks time lag between infection and death. Yes, please. Ming Pao Daily. A question about the universal voluntary RAT test. The government encourages people, the positive cases, to declare themselves. And why don't you ask people to make the declaration, even if they are negative? You just ask people to declare their positive results. Then the government will not know about the denominator, how many people really do get tested. It would be hard for you to work out the infection rate. Also, about the two disease cases, the 27-year-old patient, the asthmatic, when was he discharged from hospital and when did he pass out at home? And after his passing, was he tested for COVID? What is the CT value like? Was he admitted? Was he in a care home? And where did he get infected? In care home or anywhere? After being discharged from the hospital, the CT value was pretty high. Is it likely that he was at early stage of infection, and as time went by, his viral load increased? Were there any cases before where the discharged patients suddenly succumbed to the disease? Will the HA control situations like this? And also the breast cancer patient, it was said that she had some relief medication. Did she go to the public doctor? Was there any neglect in the process? And do we have any cases where the flights were suspended?
Thank you for your questions. First, starting tomorrow, the government encourages all members of the public to use the RAT procured themselves. They have procured, or the RAT distributed by the government, and to do a RAT test on between the 8th and 10th of March. We want to achieve some certain purposes by the RAT exercise. That is, we want to get a better picture of the number of positive cases at this moment of time in Hong Kong, so that we can know the true picture Many people are asymptomatic or only have mild symptoms. If they do not do a regular RAT, then they may not know that they are infected. Every day we have 2,000 to 3,000 new cases. It shows that there is still persistent transmission in the community. By this exercise, we want to uncover the lurking cases in the shortest time possible so that we can alert those members of the public who are infected and isolate them or stay at home. And also, they can take infection control measures and prevent infecting their colleagues and family members. And also, many people haven't had the chance to do a RAT, so it might be good for them to try doing it so that it would be they would be more familiar with it in case they need it in the future. So it is not a very very accurate because it is on a voluntary basis. Those people who are tested positive should report their status online as soon as possible so that we can take action, including issuance of isolation and quarantine orders. If you test negative in the coming few days, you should still continue to protect yourselves when you go out. In the anti-epidemic surface bags, some KN95 face masks with better protection are included. In the coming week, when you go out or when you are at a public place, please make use of the KN95 for better protection. About the number of thefts, will Dr. Lau Ka-hin please supplement? The two younger patients, the 27-year-old patient has chronic asthma. The situation is not under control. The RAT test at the hospital came back negative. However, before arriving at the hospital, he already had a cardiac arrest and he stopped breathing. The ambulance man had performed resuscitation on him. The 27-year-old male stayed at home rather than a care home. And the 52-year-old female, she did a RAT herself on the 13th and the 14th. On the 13th, after the positive result, she did not see a doctor. She didn't see a doctor. She only saw a doctor after 15 or 16 days, or 5 or 6 days. She complained of sore throat and a runny nose. And also, she is a patient with the of the oncology department because of her breast cancer condition. For a reason not unknown to us, she lost consciousness at home yesterday, and resuscitation didn't work. Sorry, the speaker is not coming through. She went to a designated clinic. Not today. Next question, the gentleman in the front. Good afternoon. News. I'm Mr. Fong. Now, the government encourages members of the public to do RAT tomorrow. Still, we heard people saying that they are not aware of the exercise? Are you worried that it would jeopardize, undermine the efficacy of the plan? And how many people or families have yet to receive the anti-epidemic service bags? Recently, the vaccination rate has increased slowly. For children between 3 and 11, the vaccination rate is only 60%. Some parents are hesitant to let their children get vaccinated. So how will the government break through this bottleneck? As we all know, elderly people and children are vulnerable groups. Thank you for your questions. Concerning the exercise between the 8th and 10th of April, that is, we encourage people to do a RAT within these 3 days with the RAT kits we have given them. I believe that most people have received the service bags. For those who haven't got one, the HAD, the Home Affairs Department, has arranged a distribution at service points. So if you haven't got a service bag yet, please go to these service points to get the service bags and the RAT in them. If you are tested positive, you should report your results as soon as possible. We will immediately arrange for delivery of medications, thermometers, temperature probes, as well as mask and oximeter. What is your last question? The vaccination rate. The government has all along encouraged vaccination among the public. The scientific committee has made recommendations concerning different age groups. For elderly people and children, if they are infected with the disease, they have a higher chance to get severe complications and even death. So through commissioning designated vaccination centers and through different schemes, the government has tried to increase the vaccination rate for elderly people and children. I appeal to the public for those who are not yet vaccinated, especially children. Parents should arrange vaccination for the children as soon as possible at vaccination center and or private clinics. With the resumption of face-to-face school coming, it will serve to protect your children. About the number of people yet to receive the service bags, I don't have the number yet. Let's take an English question.
From the South China Morning Post, so we would like to follow up on the 27-year-old. So he was he tested negative on admission on March the 16th, and later on the 18th he tested positive with CT42. So why was he still discharged despite the infection? And also, was he prescribed any oral pills to treat his COVID infection? And was it wrongful discharge after all? And also, for the vaccination scheme right now that seniors are advised to take the fourth dose, so are there any planned priorities for the fourth dose for other groups and the general public? And also, because we have seen there is a rather slow uptake of the third dose right now, so what can you do to drive up the fourth vaccination rate? And also, is there any special arrangement for those people who have caught COVID-19 after being fully vaccinated? Are they waived from the fourth jab? Thank you.
For those patients of 27 years old gentleman, actually he was admitted to the hospital on 16th of March because of the asthmatic attack, and at that time the COVID-19 PCR test was negative, and he was treated as some bacterial infection, given antibiotics as well as some medications for his asthmatic attack. He was allowed to be discharged on 18th of March, and then after he was discharged, the result of the COVID-19, the COVID-19 PCR test came back to be positive with CT value 42.7. It was very low infectivity. Actually, we discharged the patient when the patient has low CT value as low as in the range of 30. So the patient is not infective at this moment. When we know that patient was the CT value of 40 something.
So is it like infection
I can't give any comments because the patient was just admitted for 2 days. Yeah, and 3 days. Sorry, 3 days, and I cannot make any comment on whether the patient has contacted the infections in the hospital.
For the second question on vaccination, the Scientific Committee on Vaccine Preventable Diseases and the Scientific Committee on Emergent and Zoonotic Diseases, John SC, under the Center for Health Protection, and joined by the Chief Executive's Expert Advisory Panel, yesterday had convened a meeting to review the latest scientific findings and the latest epidemic situation in Hong Kong, and has made several recommendations. First of all, include that persons aged 60 years or above are recommended to receive the 4th dose 3 months after the 3rd dose. This is taken into account of the high mortality rate among the elderly, and also in the current epidemic. According to the local data, we found that the attack rate as well as the case fatality rate is very high among persons aged 60 years or above. And also the vaccine effectiveness in preventing death and hospitalization is very effective among all age groups, especially the elderly aged 60 years or above. So the scientific committee has recommended an additional dose to offer more protections for the elderly aged 60 years or above, including those living in the community as well as those living in the residential institutions. And for other age group, the scientific committee and the EAP has also reviewed the scientific evidence on whether the 4th dose is necessary. From the current data, it shows that people who have received the 3 doses of the vaccinations in other age groups are very effective in preventing hospitalizations and death. So the scientific committee will continue to review the latest scientific evidence to see if there will be new evidence to suggest that other age groups might need additional doses. So at the present moment, only persons aged 60 years or above and also immunocompromised persons are necessary to receive the 4th dose. Secondly, the scientific committee also has reviewed the safety and also the evidence on vaccination after infection. So the latest recommendation is that those who have been infected or confirmed COVID-19, if they have not received any vaccines before the infection, then they could receive the 1st dose 1 month after the infection, after recovery from the infection, instead of previously 3 months. So this is the new recommendation.
下一題。
Next question, please. AM 730. Class resumption. Class suspension, you said you have to have regard to the state of COVID. Can you be more specific, please? Let's say, do you look at the number of cases, like 3-digit cases or 4-digit cases, and the 27-year-old deceased patient, the CT value 42 something. Do you think that he was at the beginning of infection, or was he a re-positive case, or was he infected in hospital? The first test tested negative. Why did you count this towards the fatality? After discharge, was he isolating at home after discharge? And you said that he wasn't particularly transmissible. Also, Leave 'em Safe app. Dr. Ao, you said that there is a need to upload the information. Under what circumstances would you require the members of the public to do that? Let me address the first and the third question. I leave the other questions to Dr. Lau. As regards class resumption and also the class suspension, it all depends on the risk level. It's all a matter of a risk assessment. We hope that after class resumption, the COVID situation would stabilize. So we don't anticipate 0 cases, because in the community out there, we have 3,000 cases a day. When the cases decline by the end of April, and even if there is a decline, there are still cases in the community, and there may still be students who get infected with COVID. So after class resumption, previously, if there is a case, there will be a class suspension. I think we would risk assess the situation. After class resumption, we would expect the students to get tested if there are cases of infection, or every single day if there are cases, or if there are students who are absent for COVID, they will have to declare to us, and we will risk assess each and every school in this category. All depends on the number of cases, the spread, the distribution of these cases. Would they be in one class, or are they in different classes? Now, after the assessment, we would then decide whether class suspension would be necessitated. Of course, there would be some guidelines for reference by the schools that this is still in discussion. We will have regard to the data and the actual situation before we can formulate some sensible level. As regards Leave 'em Safe app, there were some questions from media yesterday about the epidemiological investigation. We very much rely on the online platform to collect the PCR positive cases and also the RAT positive cases. Now, all this information would give us the residential address, the workplace, and the family members' information. And that would enable us to analyze where the cases happen most, and then we can issue the CTNs, and whether there are any workplaces where there are outbreaks and control measures will have to be implemented. Now, if or when the cases come down further, we will get hold of the whereabouts of the patients, whether they've been to certain public places, restaurants, and whatnot. Now, we rely on people's habit of using the Leave 'em Safe app when they're out and about, and we would get hold of this information for further analysis.
Concerning our reporting mechanism, within the 28 days after testing positive, if a patient passes away, we would make a report. Whether the patient has died of COVID, we have to make a case-by-case decision. However, we are adopting the same mechanism for all death cases. That is, after the report, within 28 days, we would classify them as in the reported figure. I remind the public, if you experience unwellness upon recovery, you should see a doctor. Some people may not be mindful of their mild symptoms after recovery. As always, if you are feeling unwell, you should do a test if you haven't been infected. If you experience unwellness after a period of time after a recovery, you should see a doctor and see whether a medication is needed. Last question, please. Good afternoon, doctors. Hong Kong 01. 2 questions. First, many employees did not receive isolation or quarantine orders. That's why they were not given paid leave, and it gave rise to labor disputes. So do you have the figure of the isolation and quarantine orders as still being processed? And there are people who reported late, and they sent an email to the Department of Health. Maybe because of faulty contact information, no SMS were sent to them so that they can apply for leave. So is email an effective means? Now, fatality rate is high during the 5th wave, and we saw outbreaks in care homes. Professor Yuen said a 6th wave is likely. So besides the outreach vaccination team, would there be other preventive measures? Thank you for your questions. First, concerning the issuance of isolation orders. Since the 24th of February, as well as on the 7th of March, the CHP launched 2 platforms for those tested positive on RAT and PCR, respectively, on the 2 platforms. For RAT results, the retrospective period is the 26th of February, when we announced we would treat RAT positive patients as a confirmed case. We are aware that some patients were tested positive earlier on. They did not. They were not hospitalized, and no isolation order was issued. So through the contact information we have gathered from the SMS message, we have issued isolation order to these patients retrospectively. If you haven't received our order, please approach us via the email. Sometimes the telephone numbers are wrong, and sometimes we may have incomplete sets of data. So please do send us an email so that we can supplement the certification for you. For RAT positive patients who were not able to submit the results at once, if they have valid reasons, they can send an email to us and for us to issue the relative documents to them retrospectively. For elderly people who are infected with COVID, there is a higher likelihood that they would require hospitalization, ICU treatments, or even a higher death rate. According to scientific data, both vaccines are effective in the prevention of death of elderly patients. According to our daily analysis, for those who receive 2 doses or above, for patients who have received 2 doses compared with those who have not, the mortality rate is 27 times different. For elderly people, the difference is 5.4 times. So vaccination for elderly people is highly effective in guarding against mortality. So I appeal to elderly people who are yet to be vaccinated, please get jabbed as soon as possible before the next wave comes. Sorry, the speaker is not coming through. I don't have an answer yet. That's the end of the media briefing. Thank you.